going to show you positioning, start at the base of the hand and then working into fingers. So we always start our hand x-rays, or finger x-rays, I apologize, with a PA hand. And we want to make sure that we look for any additional injuries that may have happened. You know, a lot of times patients get their fingers caught in a door or smashed under something. So we want to do an overall view, PA of the hand, to look for secondary injuries. And then we can go definitively look at the affected finger itself, okay? So first off, I'm going to just do the index finger. Say she smashed it in her car door. Same thing applies, making sure jewelry is gone, watches are gone, again, because you're going to be doing this PA hand itself, okay? So just like before, PA hand centered at the third PIP, making sure that your collimation is appropriate, not too much, not too little. You have all of the anatomy of interest. All right, so PA hand, you've seen that before. So again, now we're gonna go to her index finger. So in this sense, this was her AP, so we're gonna do an oblique, just like you would do for her hand, right? So we're gonna do this. However, we need to make sure, keep that finger nice and straight if she can. We're gonna keep that finger isolated. We don't care about these other fingers. We're gonna keep that finger isolated itself, and we're gonna collimate down to that finger. And again, this can be a little difficult for your patients, so you can use a sponge. There's nothing wrong with using a positioning sponge. Again, centered to the PIP. So we're covering her entire finger itself. So now for the lateral, this is where it becomes a little more difficult, in that you can't, if you do a lateral like this, you can relax. If you do a lateral like this, you have so much magnification and distortion of the image itself. So what do? You actually have to turn the patient's hand over like so and get it in a nice lateral position. And it's really easy for patients in this position to either go ahead and over rotate, so making sure you keep mindful watch of the finger and making sure it's in a nice lateral position. Try, if you can, tuck those fingers down as best you can. Can be a little difficult, especially if someone just smashed their finger, but I promise it can be done. And again, just adjust your collimation as such. Marker here, making sure it's not in anatomy of interest. And that would be a finger x-ray.